You know that feeling? The fatigue, maybe a dip in your mood, a lower sex drive. Is this just the inevitable reality of getting older, or could it be something more specific, like low testosterone? Today, we're going to decode testosterone therapy. We're cutting through all the hype to see what the science actually says. And we'll be using a major review from the incredible European Urology journal as our guide to get to the real story.
All right, so here's our game plan. First, we'll get really clear on what low T even is. Then, we'll dive into how it's properly diagnosed, what the therapy actually promises to do, what the real risks are, and finally, how the whole thing is managed for the long haul. Let's jump in.
So first things first, the problem itself. A lot of men wonder about their testosterone levels, right? But the symptoms can be just so frustratingly vague. So what are the signs that really matter?
And this right here gets to the absolute heart of the confusion. All of these things, feeling tired, being in a low mood, they're incredibly common. I mean, they could be caused by stress, not enough sleep, or just life. It's that huge overlap that makes a proper medical evaluation so essential. You just can't guess.
So how common is this really? This number? It's a real eye-opener. A massive European study found that when you look for men who have both clinically low testosterone and the specific symptoms that go with it, it's only about 2%. Wow, that's a far cry from what you might hear in some of those ads, isn't it? Now, what's really interesting about this, and what helps clear things up, is how it breaks down the symptoms. You see, the most specific, the most sensitive signs of a real testosterone deficiency are almost all related to sexual function. Those other less specific symptoms, like fatigue or being irritable, well, they're just not as reliable on their own.
And here's where we come to a critical fork in the road. You'll hear doctors talk about two main types. Organic means there's a permanent issue with the body's hormone factory, so to speak. But functional is a whole different story. It's often tied to things like obesity, and the great news is it can sometimes be reversed just by improving your overall health.
Okay, so you think this might be you. How did doctors actually figure it out? Well, let me tell you, it is way more involved than just getting a single blood test.
Now, I know this chart might look a little intense, but what it's showing is the official, super careful pathway that doctors are supposed to follow. It's a step-by-step process designed to make absolutely sure it's a true deficiency before anyone even thinks about treatment.
So the crucial point here is all about confirmation and investigation. Step 1 requires at least 2 separate blood tests, and they have to be done in the morning when testosterone is at its peak. This is to make sure the reading isn't just a one-time fluke. Then, if the levels are consistently low, step 2 is all about figuring out why by checking the brain's signaling hormones.
And this is exactly where those other hormone tests come in. Think of LH and FSH as signals from the brain, telling the testes to get to work and produce testosterone. So if your testosterone is low, but those signals are screaming at the top of their lungs, well, the problem is in the testes. That's primary. But if testosterone is low and the signals are also quiet or just normal, the problem is with the signaling from the brain. That's secondary. See how that works?
All right, now we're getting to the core of it. If a man has a confirmed diagnosis, what are the proven benefits of testosterone therapy? What does all the research actually show us?
So what's the potential upside? Well, the evidence points to a whole range of proven benefits. We're talking about better body composition, less fat, more lean mass, stronger bones, improved metabolic health, like better blood sugar control, and of course, a significant boost in sexual desire and function.
And look, this isn't based on a handful of small, isolated studies. These are the heavy hitters, 3 landmark trials. The T trials confirmed the benefits for older men. The T4DM trial showed it could actually help prevent type 2 diabetes. And then there's the Traverse trial, which gave us critical new information on heart safety, which, believe me, is a huge deal. Of course, no effective treatment comes without potential risks and side effects. For decades, this therapy was kind of clouded by these big concerns over heart disease and prostate cancer. So let's take a hard look at the modern evidence. This quote right here, it's a big one. The Traverse trial was specifically designed to test cardiovascular safety in a high-risk group of men, and its conclusion that therapy did not increase the risk of heart attack, stroke, or cardiovascular death was a pivotal moment. It went a long way in reassuring doctors and patients. And the other ghost in the machine has always been prostate cancer. But the story here is pretty much the same. Multiple, large, well-designed trials have looked for a link, and they just haven't found one.
The data we have today simply doesn't back up that old fear that therapy increases cancer risk when it's used appropriately.
So, what are the actual risks to keep an eye on? Well, the most common one is something called polycythemia. That's just a fancy word for an increase in red blood cells. And this is exactly why regular blood monitoring is absolutely non-negotiable. Other side effects are usually tied to the specific delivery method, like skin irritation from gels or some pain from injections.
Okay, this brings us to our final piece of the puzzle. If a patient and their doctor decide to move forward, what does the treatment and the long-term management actually look like?
You know, before a doctor even reaches for a prescription pad, every single major guideline agrees on this point. For men with that functional type of low T who are overweight, the very first step is lifestyle. Diet and exercise can lead to weight loss, which, all by itself, can significantly boost testosterone levels.
Now, if medication is the right path, you've got options. The two most common are injections and gels. Injections can be less frequent and cheaper, but they might cause some peaks and valleys in your hormone levels. Gels, on the other hand, provide a more stable daily dose, but you have to apply them every day and be careful not to transfer the gel to anyone else.
And the menu of options just keeps growing. There are now modern oral medications that are much safer than older versions, and even implantable pellets that last for several months. They offer a kind of set-it-and-forget-it approach, though they do require a minor procedure in the doctor's office.
It's so important to remember that therapy isn't a one-and-done decision. It's really an ongoing partnership with your doctor. This timeline shows the standard plan: checks before you start, a follow-up at 3 months to see how things are going, and then regular monitoring every 6 to 12 months to make sure the treatment stays both safe and effective.
So what's the actual target here? What's the goal of all this monitoring and adjusting? It's not to achieve some superhuman off-the-charts levels. The clinical objective is simply to restore testosterone to a healthy, stable level right in the middle of the normal reference range. That's it.
So, where does all this leave us? The science has clearly come a long, long way, moving past old fears and into an era of really solid evidence-based medicine. But it also opens up a much bigger conversation, doesn't it? As we get better and better at fine-tuning our own biology, what's the line between treating a true medical deficiency and simply optimizing our lives? Where do you think that line should be drawn? It's a question we're all going to be grappling with as this science keeps pushing forward.